Hi, my name is Ali Mukhtar. I am an associate consultant in the Division of Hematology at Mayo Clinic, Rochester, Minnesota. I'm about to present a work entitled A Modern Primer on AL Amyloidosis in 592 patients with mass spectrometry-verified typing. Systemic amyloidosis can stem from different sources of amyloidogenic proteins. Immunoglobulin light chain amyloidosis, also known as AL amyloidosis, is the most prevalent amyloidosis type. The amyloidosis type determines disease presentation, prognosis, and treatment. Therefore, it is paramount to achieve an accurate typing. Mass spectrometry is the gold standard for typing and is available in our institution for routine clinical practice for over a decade now. We sought to characterize a large cohort of AL patients who all had AL type confirmed by mass spectrometry. This will allow for the first time to explore AL amyloidosis without concern for inclusion of mistyped patients. 592 patients are included in this study. Compared to historical cohorts from 3 to 5 decades ago, the fraction of patients with cardiac involvement has nearly doubled. This shift likely to represent the current ability to detect early cardiac involvement using soluble cardiac biomarkers and advanced cardiac imaging, which emerged in the past 20 years. The most commonly involved organs were heart and the kidneys, with 76% and 53% respectively. The heart and the kidneys were also the most common organs to present as a single organ involvement. 19% of all patients had isolated cardiac involvement, while 9% of patients had isolated kidney involvement. This allowed for exploration of the differences in disease presentation between isolated organ involvement to multi-organ involvement. While patients with heart involvement had a similar survival whether they had an isolated heart involvement or multi-organ involvement, patients with renal involvement as single organ had a better survival than patients with non-isolated renal involvement. This emphasizes the dominant role of heart involvement on outcome. Moreover, there was almost no difference in cardiac function between isolated cardiac involvement to cardiac amyloidosis with more than one organ involved. In contrast, patients with isolated kidney disease had higher degree of proteinuria compared to patients with kidney amyloidosis with multi-organ involvement, likely due to higher blood pressure favoring urinary protein loss in the later patients. This study also highlights that when amyloid typing is accurately performed, the fraction of patients with negative monoclonal protein studies in the serum and in the urine is less than 0.5%, unlike historical cohorts. In conclusions, this study is a comprehensive review of presentation and outcome of AL amyloidosis that was accurately typed using mass spectrometry. This study may serve as a benchmark to assess accurately changes in disease recognition, presentation, and outcome in years to come. Thank you for your attention.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.